Hello, everybody. Welcome back to the Genius PT Project. Again, our goal with this project is to have real conversations about difficult subjects in physiotherapy practice to really get to the heart of what's important in our practice, namely integration. So these podcasts are designed to be mini classes for a variety of topics that present challenges to us collectively as healthcare professionals. So let's talk about today's project, or this coming quarter's project. It's project number 4. This is session A, and it's called Compassion and Pain Care. You are not everyone's healer. And we are thrilled to have Shelly Prosko with us for the next 2 sessions, so B and C, as our guest speaker. And we are going to start off today with just talking a little bit about compassion and self-compassion, both within our practice, but also within ourselves. Before we get started and I turn it over to Susan, I'm going to take just a moment to welcome our new co-host, Joletta Belton. And Joletta, if you joined us for the last project, Joletta was our guest speaker. And it was just fabulous to have the patient perspective, or a patient perspective, within the projects that we're doing. And so we are thrilled that Joletta has agreed to join us on an ongoing basis to really provide that patient narrative. So Joletta, thank you again for agreeing to be with us and agreeing to co-host. So welcome.
Thank you. I'm so grateful to be here.
All right, I'm going to turn it over to Susan, and Susan's going to lead us through this presentation.
Okay, I'm more than happy to do that if you will take us to the next slide. So Shelly Prosko is our guest expert this quarter. I met Shelly online many years ago, and we've traded all kinds of information online and have kind of gotten to know each other online. I met her in person in England, Brighton, England, this last year in April at the Women on Fire conference that Jenny Burrell puts on out there, and we were both speaking, and Shelly was so excited about the new book that's coming out, or that is out now, Yoga and Science in Pain Care. You can also find Shelly at her physio yoga website. She has a blog. She's got all kinds of information out there. And Shelly was actually the author and the editor. She was one of the authors and an editor of this book. And so a lot of what we're going to talk about tonight is coming from her work in this area. So one of the things we want to think about is compassion in pain care, because pain patients can be challenging, pain situations can be challenging, and as healthcare professionals, and the types of environments and the structure and in the circumstances they work in, that can also create some challenge as well. So we'll try to tie this together and end up with a few easy, gentle steps that everybody can take that can move them forward to working better with complex patients. So when we think about that, we're going to think about compassionate care for people in pain, cultivating self-compassion within the person in pain. So we want to be compassionate to them, but we also want to help build self-efficacy for them to be able to have their own compassion as well. And then cultivating self-compassion within the health professional. So not only is it important for the person in pain to develop their own self-compassion, but it's important for us as healthcare professionals to create our own self-compassion so that we can create that co-narrative as we go forward.
And do you think, Susan, that self-compassion in healthcare professionals is a skill that we have to learn when we're dealing with people in pain? Is it a negotiable or a non-negotiable? What do you think?
Since I've been on this journey, I would probably have to say now it's non-negotiable. That in order to really meet people where they are and really begin to understand and identify and validate all of the things that they're going through and identify them as an autonomous individual who knows best about what needs to happen for themselves, and for them to feel heard and for them to feel empowered, we have to be in a position where we're able to provide that. And so if we're not taking care of ourselves, if we're not being compassionate with our own self and learning how to really work in this type of environment, then it's not going to be as successful as an alliance. Joletta, do you have anything to add from that from the patient point of view?
Yeah, I think that it's so important, and I know we're going to get to it in future slides too, but how self-compassion in the patients really comes from receiving compassionate care from the clinicians. And I think that compassionate care from the clinicians can only happen when they're taking care of themselves and have compassion for themselves too. And then it leads to a whole different reframing of the entire encounter, where it's not challenging patients, but challenging situations, people who are facing challenging situations. And we see that a little bit differently. And for patients, it's not a challenging clinician. You know, it's
Exactly.
these situations that we're in that are really challenging and difficult to work through. And so on both sides of the equation, we really need to take that compassionate stance, not just for each other, but for ourselves as well. And then being able to receive that compassion too, which can be really difficult. And it's not something that any of us are taught. You know, it's not something that you are taught in school when you're learning how to become a physical therapist. And our systems aren't really set up for that. So it would be great for people to start taking whole systems approaches and within clinics and within healthcare systems to say, this is how we're going to do things to take care of our own people who are taking care of people. And I think that's where this research can really lead us. And I think that will be really important in terms of preventing burnout and like empathy fatigue and those sorts of things that I know Shelly will touch upon when we talk to her next month. And that compassion, and reading some of Matteo Ricard's work, that compassion is almost like an endless well, where empathy is not. Where if you have the empathy without compassion, it can lead to burnout, because then you're just suffering with the person without that kind of altruistic love and that compassionate stance. So I think that's a really interesting thing to think about too, because empathy is a big buzzword in healthcare, and maybe we should be shifting from thinking about just empathy to thinking about compassion.
And we talked about empathy in our very first project with Alison Sim and the importance of empathy in developing a therapeutic alliance. But I really love how compassion now and self-compassion is building on empathy. So you first have to have empathy. That is an important key ingredient, but it can't stop there, right? And so I'm really excited as we start to explore this topic a little bit more.
Right. And so thinking about that, it's kind of important, I think, to always go back to what is compassion, because it has a different meaning in different circumstances and situations. So the really quick definition out of the, the regular definition books, simplistically, is extending kindness towards another. But this doesn't uncover the emotional complexity of true compassion for yourself and for others. You know, we can be kind and still not have the fuel driving behind it. I think, Carolyn, when you talked about it, going with empathy first is important, but to me, compassion is what fuels the empathy. And
it's
keeps
circular almost, isn't it?
Yeah, keeps it stronger so that it's sustainable, and you're not running into deficits and fatigue with it. But Getz, his name is Getz, not Goetz, in 2010, and Gilbert in 2017 had some additions to these definitions. And the awareness of pain and suffering, and the desire and motivation to relieve the suffering. And we'll get into the breakdown of how you can actually train compassion on the next slides, but also a sensitivity to suffering in self and others, with a commitment to try to alleviate and prevent it. So not only is it good to be kind, but it's also good to go in with the motivation to what is it that this person needs, and how can we begin to start to bridge the gap to get them from where they are in their place and to move to a different place.
And I think that's what sets it apart too, the compassion, where the empathy, you're just sitting in the suffering with another, and then the compassion is that motivate to alleviate that suffering and take those steps to help them through that.
Right. And so for the person in pain, some of the literature that has been looking at compassion care and these things along the lines of what we had just defined earlier, for the person in pain, it's been shown to improve quality of life, outcome, satisfaction, the therapeutic alliance, which Carolyn mentioned earlier, that was on our first project, management with chronic illness, and reduction in cost of care. And that can actually swing both ways, reduction of cost and care for the healthcare provider, but also for the client. The person is facing probably giant financial deficits or determinants around their own care at some point too, when it's complex or chronic. but it also contributes to the person's ability to improve their own self-care. So starting off with the compassion piece with that person can actually build that self-efficacy into their own self-care that they may feel is missing, or may not even really understand that that's missing at this point because of the suffering and what's happening with them. For the healthcare provider, this is the big one. It improves physical, mental, and emotional well-being, reduces the chance of professional burnout and anxiety. And it also, interestingly, what I thought was fascinating reading through the literature, decreases medical error and malpractice claims.
Very interesting. And you know, I think it starts with, and we're gonna practice a little bit at the end with one of Kristen Neff's self-kindness meditations. But as I read through this literature this weekend to prep for this conversation, I was thinking, you know what, how amazing would it be to wake up every morning and just do a 5-minute self-kindness meditation, and just to kind of set, as a healthcare professional, the tone of our day around, first of all, kindness to myself, which then should emulate kindness and compassion to my patient. So I'm going to challenge myself with that. I don't know about you ladies, but I'm going to try.
I do a 15-minute meditation every morning when
Do
I
you?
get up, and when
Yeah.
yes, I did something I picked up a few months ago. It's been transformative for helping me, you know, the shifting sands of my life. But the interesting thing is all of us, you know, whether we do it through meditation or self-talk, or, you know, and Joletta, even you coming from the other perspective, but you're now working with healthcare professionals and working on increasing the client narrative, you know, with literature and research and speaking engagements. So there's, you know, potentials there as well for, you know, the changing roles that you have in your life too, you know, to just really almost feel like you're enough.
Mm-hmm.
Yeah, it's
and
so
remind
important.
ourselves.
I had the great fortune to contribute to Shelly and Neil and Marlissa's textbook too, and wrote the first chapter. And in there, I talked about how important, and I didn't know how important it was going to be going in, but how important self-compassion ended up being for my own, you know, journey to get better, my own healing process. And I think it's a common trait amongst both patients and clinicians that we can beat ourselves up a lot. You know, we can take on a lot of blame and shame for either not getting better if you're the patient, or for not fixing people if you're the clinician, or not knowing how best to help that individual, or not have the resources to help them where they are. And it can become a place where we start beating ourselves up over that, or blaming ourselves, or there's a lot of perfectionists in healthcare, and there's also links between perfectionism and chronic pain as well. So I think that self-compassion and self-kindness stance is a really important skill to cultivate and practice, and it is a practice. Because I still beat myself up all the time about all sorts of things, but being able to keep coming back to it, which is what meditation practices are about, is about coming back to it, is so valuable. And in that, for the person in pain, and it being able to contribute to the person's ability to improve their own care, I know we're going to address it in the next slides, but so much of that comes from, for me at least, it came from not even realizing I was still of worth, that I was still of value, until being given that sense from somebody else, from somebody outside of me, to say, you're still worthy, you're still of value. And then receiving that compassion from someone else allowed me to start taking better care of myself, and to start prioritizing self-care and doing those things that I needed to do.
What a great introduction to the next slide. Susan, I'm going to let you take that away.
Right. So one of the studies by this group, Armand and Hawk, was very powerful. And it was a study that they did with women with fibromyalgia. And they found out that they could only engage in self-care once they received the compassionate care which helped them feel welcomed, listened to, and worthy and whole. Those are just the same words Joletta just gave us a couple of minutes ago. You know, they need that people isolate themselves and suffer from the very people and tribe that they need to re-engage with to rediscover their place, because it's changed. But that doesn't mean because their place and how they behaved before, or the roles that they had before, are bad. It's just that it's now different, and being able to find and discover those new ways. And part of the way to get people there is to really listen and pay attention and a safe place where people feel like they're really being heard.
And being cared for. I think that
Yeah.
caring, that caring environment is so important.
Because once they're cared for, that self-compassion or that self-love can come through again.
I was just going to add, not even just being cared for, but being cared about. Sometimes we forget that piece too. You can care for someone without really caring about them, and that caring about piece can be really pivotal for a person who hasn't been felt cared about in some time. I love this quote.
Yeah.
Yes, and this is an absolute fabulous quote from Howard Brody. And I'm not going to read the whole thing because you can read it at
But
your
maybe you should, just because there are people who are going to be
Yeah,
listening.
well, that's
right?
true. People might be listening and may not have
right.
the slides in front of them.
That's right.
May I read it?
Yes, please.
May I?
Absolutely, please.
Only because this has been one of the most. Howard Brody is a bioethicist, and he's was a family physician too, but his work has been so influential in me figuring out my own path forward in retrospect too, and in understanding where I've been, as well as kind of crafting that path forward. And when I read this, it hit home to me in so many ways, and because it's so true. And I think that it shows so well what the value of healthcare really is. When you and this speaks to those women, the fibromyalgia patients who said that getting compassionate care helped them to feel whole again. So at the heart of suffering is feeling that what ought to be whole is being split apart. This feeling may be experienced as a split between oneself and one's malfunctioning body, or as an isolation of the self from the human community. Suffering cannot be relieved, however elegant a cure one performs, unless the patient's subjective sense of split and isolation has been assuaged. Almost always, this assuagement requires a sense of reattachment to the human community from which the patient, through illness, has felt cut off. The physician or clinician is the human ambassador who most often and most directly can reach out and reestablish this sense of human connection.
Can you give us an example of how that has played out in your journey, Joletta?
Yeah, so for me, and especially in being able to look back after I was reading this, and so much of my suffering came from, number one, like I hated my pain, and I hated my hip and my leg as a result of that. And that I considered my pain the enemy. So essentially my hip, my leg was the enemy. And during all of that time too, I had this sensation that my leg wasn't mine, that it was other, that it was alien, that it was foreign, that it was this thing to be fought and be rid of, because it embodied this pain. It was the traitor that let this pain come in. And I felt crazy until I read Oliver Sacks' book, A Leg to Stand On, when he experienced the same thing after a leg injury and his hospitalization for it. So I was split apart from a part of my body. Then I was also split apart from broader humanity as well. I mean, even just from my own family, my friends, my community. I was so isolated and withdrawn. And my world had become so small and so dark and so just filled with pain and nothing else. And I was just totally disconnected from everything, from all of the people, all of the places, all of the experiences that had mattered to me and gave my life meaning and gave me a sense of purpose. So that's why I feel like this quote is so powerful, and it's a part of Kristen Neff's the three elements that she focuses on too. Is one of that is our common humanity, that reestablishing that sense of our common humanity, that sense of humanity with one another, that you're not alone in this, that you are not alone in your suffering, that you're not the only person who has suffered or been in pain, and that you're not going to have to go through this alone. It's such a powerful thing to feel and experience, and just gives hope that there's a different way forward, that there's a different path forward. It's almost indescribable how disconnected you can become from your life and yourself, and how valuable establishing those connections again can be, and how simple it might be. I can't remember if it's the next slide or not.
It is. So let's take it right there. Yeah.
So for me, that moment came when I was in graduate school. So I was studying pain science, and I had to interview someone in my field for a research paper. And I didn't have a field anymore because I was medically retired and I was in pain. So I figured my field was pain. And I interviewed Lorimer Moseley. And I was still looking for that one thing, you know, that one fix, that one thing that was going to change everything. And I grilled him for 45 minutes about the science. And at the end of our talk, I said, what's the one thing you would want people in chronic pain to know or to do? And his response was to love and be loved. And it sounds like hubris to say that it changed my life, but it did, because that was the moment where I felt like I was of value again. Like he had spent all this time just having a conversation with me, which showed me that I was of worth, that I was still a human of value. And he made me question my own sense of not being lovable anymore and not being able to love anymore. That maybe that wasn't true. Maybe I still could love and be loved and be receptive of that love, almost like compassion, like altruistic love, like Mateo Ricard calls it. And it's really what set my trajectory on a different path and what led me to be able to start being more compassionate with myself and to not beat myself up so much for not being better already. Because at that point, I was over 4 years into my pain, and I should have been better at that point. So it just opened the door to everything. So like in looking back for me, that moment was so pivotal in being able to get my life back and to reconnect with all of those people, places, and experiences that matter to me, to reconnect with humanity, to be able to be present again without fighting and resisting it, with being able to accept my leg as part of me again and my pain as a part of me again, and reconnecting with myself. So it was a big thing for me.
Incredible that it goes back to what Susan was just talking about, that it took compassion from a caregiver. And this was, I mean, Lorimer wasn't directly caring for you, but he was showing caregiving to you in this process. And it started with that for you to be able to then develop your own sort of self-compassion.
Yeah. And I think what's so powerful about that too, this was over Skype.
Right. Like, incredible. Right. Yes. Not even face to face. Right. Incredible.
Can happen.
Incredible.
So speaking of what Joletta was just talking about, the capacity of healthcare providers depends upon a number of factors: mindfulness, which we'll go through, common humanity, and you spoke very great about the common humanity. It's instead of looking at, like the article we talked about in the very first project, Carolyn, on othering,
right?
The tendency for humans to look at another human is to compare and contrast. What's different about them than me? What's different about them and their tribe than my tribe? And what we want to look at is the common humanity. Where are we alike? We know there's differences, but where is the common ground? And then, of course, kindness, as we spoke to earlier. And so, is compassion trainable? So we've talked about the loving kindness meditation, and so it does decrease feelings of burnout and increase resilience. And we're going to do a little exercise on that at the end of this, right?
Yep.
So everybody can just get a feel for that. But then Halifax in 2012 really went through a whole list of things that they felt like compassion is an emerging sense of coming from these component parts down underneath this place. So attention, skilled listening, the affective domain, awareness and regulation of emotions, your own, and intentional, which is the place to place the intent to help based on mutual values. In other words, to create that co-narrative that Joletta has talked about. And I use that all the time because it's such a perfect world. Don't cover their story with your clinical story. Find the common ground, that common humanity, and find what it is that you can do together that's going to make sense to them. You practice all of the above, and this helps the healthcare professional to gain insight into the person suffering because you're influencing clear thinking and reasoning. So when you practice this, you actually become a little bit better at kind of sitting back and really taking their story in and getting curious about where is it that they're willing to change and ready to start. Then you can embody this, attending to what is happening in your own body while understanding the needs of the other. So that's going to reduce the empathy and the professional fatigue because you're able to keep yourself as yourself, but you're able to also have space for that person there without judging, without coloring, without covering their story. And then you're engaged, which takes compassion into action. Validate the person's experience, mindful listening, be curious. How can I serve? What can I learn? What does this person need to succeed? And then always have some sort of boundaries around your professional experience. And that encourages the client to have boundaries too. But for professionals, you can ritualistically finish the session before you start to the next one. So some of us are going from client to client to client, but it's really important to build that little bit of space at the end, even if it's something like washing your hands and taking 2 deep breaths, closing the door, closing out, put an end to the session so that that person and their business and who they are does not take you into the next session. And that can also help being able to stay into that nice attention, effective, intentional practice as you go into the next session. And so that's kind of the components that they look at training with, getting people to change how they're engaging with clients.
It's so interesting because as physios or as healthcare providers, we often think about these components as being soft skills.
Mm-hmm.
But if I hear it called soft skills one more time, I might not be very happy anymore. This is not a soft skill.
No.
This is a basic life skill for clinicians.
This is a foundational skill.
Foundational, not only for our own boundaries and our own sense of well-being, but also for our interactions with our patients. So that's amazing.
And
I really
beyond that with families, and children,
oh, absolutely,
and everyone.
Right. Yes. Well outside the clinic, right? All right.
It's always nice, I think, to have at the end of a talk like this, because everybody gets a little bit inspired, like, oh, and then it becomes like an overwhelm. I can't do all of this at work. My work has this problem and this problem. So what I put together here were just some gentle steps to take, some easy first steps things. So the first one is provide a safe place for the person in your care, whatever that looks like. Create a space in your clinic room, create a space. If all you have is the corner of a clinic and a curtain, you can still create a very safe place where that person can feel like that they're going to be able to tell their story and do the things that, and really, really, really communicate with you. And then spend the time listening mindfully, not distracted, not thinking about your grocery list and all the other things you need to do that day. But listen mindfully to their story without judgment or conclusions. And that for physios is tough because we're trained to create a hypothesis within the first 15 seconds of somebody opening their mouth. And, so you can still have those, and that you're not going to stop that thought process. So I don't even want you to try that, but just know that you don't have to use that, hypothesis that may come up and pop up, because that's kind of a normal brain action that you have. But continue to just say, okay, that's kind of nice. I'll put it to the side. I'll space hold it. But I'm going to continue listening to their story, because there may be more to this story than what my immediate conclusion may have drawn. And then be curious. Ask questions about their story. Find out what they believe and or what they need. Don't ask a lot of closed-ended assessment questions, but really ask them, instead of saying, how long has this been going on, say, what's changed in your life since this has happened? Be curious, really curious with your questions, and create the co-narrative from the combined knowledge of what the person has given you and what your head is beginning to tell you, like, oh, I think this, but I don't want to cover their narrative with that. I want to just be able to kind of sit and let's together be able to create that. Where can we meet in the middle? Where's the common ground that can be the next step for change? And then finally,
can I just comment before you go
yes,
to the last
please do.
piece? Because one of the things that came out of this reading and out of our last conversation, even with Joletta, was don't rush to fix without validating the patient's pain experience, right? It's like, take that time. You don't have to be solutions oriented right at the beginning. Mm-hmm. Again, with that validation and really being feeling being cared for is what's going to then create the magic for that patient to then create their own change.
Mm-hmm.
It's their change they're creating, right?
Right. And you're going with their change. This is their journey, not yours.
Yeah, Joletta?
I was going to say, it's one of what you were just speaking to, Carolyn, jumped out at me both at the San Diego Pain Summit when Shelly was speaking about this, and then in your chapter too. That rush into fix actually engages those protective systems. It engages that threat response. So it's not helpful. If anything, it could be setting you back a few steps. So where you think that you need to hurry it along to get to the point is actually maybe slowing things down and getting to the point even further down the line.
Right.
I just thought it was fascinating when she had brought that up, and then it was in the chapter too, and I was like, oh, 'cause I can sense that as a patient. If someone cuts me off, then those barriers go down. You know where you stand, and it's no longer that co-creation. It's no longer that shared decision making. You're just going to be told what to do and what your problem is.
And for everybody listening that tends to be more on the scientific side, Stephen Porges, who is a neurological physician and does a lot of writing, will talk about the actual neurological response to not being validated and or being cut off or having somebody color your story with their own clinical story. And he does talk about it in the way that Joletta was explaining, that it is a threat response, and that's actually going to drive down the vagal response. What you're really trying to look for is to get the serotonin up so that the brain itself can begin to start reorganizing and starting to go, oh wait, this isn't, I can do something different. So there's a lot of neurophysiological underpinnings to this. So it's not just woo stuff. It's just, or as Carolyn said, a soft skill.
Yeah.
This is a brain to brain skill, and this is what's important with our clients.
And it's hard. It's not soft.
It's not soft. It's hard. It is hard, which is why we don't want to do it. Oh, we don't need that. It's just a soft skill. No, it's a hard skill. And it's absolutely.
And even the self-compassion for yourself is hard. It can be really hard to start setting up that practice and take that time and do all of those things, because behavior change is hard. Humans changing their behavior is not an easy thing to do.
Which is why the gentle steps here.
Yeah.
Because change is hard, but it's not insurmountable.
No.
Especially if you do small pieces at a time. Small hinges swing big doors.
Yeah.
You don't have to tackle the whole thing at once. And then finally, the last point here is take care of yourself. Take is the thing. Take care of yourself. Eat some nourishing food. Move your body. Rest well. Breathe. Create that ritual boundary around your sessions. Any of those, pick one and stay consistent with it, and it's going to begin to change all of everything else around you, which is kind of nice. You can take these step by step and just pick one piece to go with it. Because once you start making those changes and you do it consistently, your practice is going to change and look quite different.
So let's practice. What does that look like? So here's and it didn't embed. Hold on one sec. If I end that, we were going to do a self-compassion meditation, but for some reason, I wonder if I pulled up the wrong presentation here. Let me just.
I see the little audio thing in there.
Do you see the audio thing in there?
Yeah, it's inside the hands.
Oh, I missed it. It's inside. There we go. I was looking for below. Thank you, Susan, for seeing.
You're welcome.
The hands are actually holding it.
The hands are holding the self-compassion practice. Well, this is Dr. Kristen Neff, who's probably known best as the world's leading expert, perhaps, on self-compassion. She's done a lot of the lion's share of research. This is her self-compassion break. It's 5 minutes long. This is my commitment. I do have a meditation practice, but I'm going to actually just kind of fine tune that into more of a self-compassion practice for maybe a month or two and just see how that plays out in my own sort of life. So why don't we, if you've got time, why don't we go ahead and do this together? And if you need to go, we will see you at our next session in October with Shelly Prosko. So here it goes.
This practice is called the self-compassion break, and it's something you can do anytime during the day or at night when you need a little self-compassion. So to practice this exercise, we actually need to call up a little suffering. So I'd invite you to think about a situation in your life right now that is difficult for you. Maybe you're feeling stress, or you're having a relationship problem, or you're worried about something that might happen. I'd invite you to think of something that is difficult, but not overwhelmingly difficult, especially if you're new to practicing the self-compassion break. So finding a situation and getting in touch with it. What's going on? What happened? Or what might happen? Who said what? Really bring the situation to life in your mind's eye. And then I'm going to be saying a series of phrases that are designed to help us remember the three components of self-compassion when we need it most. So the first phrase is, this is a moment of suffering, right? We're bringing mindful awareness to the fact that suffering is present. And I'd invite you to find some language that speaks to you. Something like, this is really hard right now. Or, I'm really struggling. We're actually turning toward our difficulty, acknowledging it, naming it. This is a moment of suffering. The second phrase is, suffering is a part of life. Okay, we're reminding ourselves of our common humanity. Suffering is a part of life. And again, finding language that speaks to you. It may be something like, it's not abnormal to feel this way. Many people are going through similar situations. Right? The degree of suffering may be different. The flavor of suffering may be different. But suffering is a part of life, part of being human. And then the third phrase is, may I be kind to myself in this moment. And to support bringing kindness to yourself, I'd invite you to perhaps put your hands over your heart or some other place on your body that feels soothing and comforting. Feeling the warmth of your hands, the gentle touch. Letting those feelings of care stream through your fingers. May I be kind to myself. And using any language that supports that sense of kindness. Perhaps language you would use with a good friend you cared about who was going through a very similar situation. You know, it may be something like, I'm here for you. It's going to be okay. I care about you. You can even try using a diminutive if that feels comfortable. You know, oh, darling, I'm so sorry. Or you can try calling yourself by your first name. Anything that feels natural to express your deep wish that you be well and happy and free from suffering. And then letting go of the practice. Noticing how your body feels right now. Allowing any sensations to be just as they are, allowing yourself to be just as you are in this moment.
All right. So that self-compassion break is on Kristen Neff's website, selfcompassion.org. And so I'd encourage you to go and take a listen again and see what you think. Susan, do you want to just conclude for us?
I'll be happy to.
All right. Let me just get you to the last slide here.
So I'll leave you with this last sentence. In the same way it seems self-care can follow compassion care, it seems that perhaps compassion care follows best from self-care. So they kind of work together. Like Carolyn said, I think you said at the beginning, it's like a big circle, right? Mm-hmm. One keeps feeding into the other and helps that. Thank you for being with us today. We're excited to be hosting Shelly Prosko. We are going to be taping the interview with her in late October. So look for that to come out in early November. And then we have her scheduled to come on for all of you to join her on November the 11th. So sign up on our website, www.thegeniusptproject.com, and join us. You'll be able to come right on and talk to Shelly and ask her questions. And yes, as we had on the very first or second slide, Joletta's holding up the yoga and science in pain care. Is that the article that Shelly wrote? I think it's chapter 14, if I'm not mistaken. The work that we talked about here came from that article, and Joletta wrote the foreword or the
first chapter.
Yeah, the first chapter. Yes. So the logo to the book is on the second slide that we had up. And we'll put it in the show notes as well on the website so that you can access and purchase this absolutely fantastic book that is available now. So anything else, anybody?
No, thank you so much. And thank you again, Joletta, for sharing your story and your thoughts from a patient perspective. It's much appreciated.
Thanks so much.
All right, we'll talk soon.